Digestive system is quite an intricate process, and as I mentioned earlier, if you don't support the digestive system and you just start popping pills, it's really not going to do you that much good. So whenever you start a process, you always want to make sure that the digestive system is functioning properly. And with that, you have the stomach, and we want to make sure that we produce enough hydrochloric acid in the stomach. And if we don't, then we can't it's that emulsification or that breakdown of protein, and also it allows in a lot of the different minerals to become available if we have enough hydrochloric acid. And as we get older, we tend to then produce less and less and less. And instead of then throwing acid blockers like omeprazole or Prilosec or anything like that, we actually want to promote more production of the hydrochloric acid so that we can then digest the food, we can utilize the nutrients from the food, and then we can then strengthen the tissue that needs all these nutrients. One of my biggest heartaches is when you have these medical doctors, they go in and they just remove gallbladders right and left, and they remove organs, and they sometimes do it just to see whether symptoms will disappear. You have some patient coming in and they're dealing with the digestive distress, and they try then some acid blocker, and that's not helping. So then they think, well, maybe it's a gallbladder. Let's just remove it just in case and see if it's get better. So it's kind of like you have an ache somewhere in the body, you remove the leg and see if the ache disappears, and then you know that it was the leg that was causing the problem. The gallbladder has a very specific function. With it, we then digest all the fatty substances that we eat. And without the fatty substances, we can't produce hormones. We can't really, it has a huge impact on the immune system. We have a hard time then to detoxify and remove all these chemicals and metals and things that we are exposed to on a daily basis, in addition to from all the metabolic activities that happens within the cell. All these toxins needs to be removed from the body. And if we don't have gallbladder, then it's kind of like we're handicapped in that whole process. And we're always going to be behind in our ability to remove these chemicals.